Sorry, I gotta use my cheaters. I have to do it. Thank you very much, ladies and gentlemen, for coming here tonight to support St. Jude Children's Research Hospital and to listen to part of Marit's story. We are honored and pleased to be here to speak on behalf of St. Jude tonight. We just returned last week from a recent visit to St. Jude and have a renewed passion to talk about this incredible place. But first, some background. Prior to Marit's birth, my husband Michael and I were already personally and professionally connected to St. Jude. Michael was a Target executive at that time. We personally attended a few St. Jude fundraising galas in Hollywood with close friends of ours who are longtime friends of Tony Thomas, who is the son of Danny, the founder. Shortly thereafter, Target became a corporate sponsor of St. Jude. Though merely a spouse of a Target employee, I felt tremendous pride in this corporate association. Given my professional nursing background, the hospital and its mission deeply resonated within me. In fact, I chose to spend my 40th birthday with friends at a St. Jude benefit gala over a decade ago. I had just 3 children then. I specifically remember watching the featured film of the children at St. Jude that night, just as I had at several previous galas. As compelling as the film was, the thought never entered my mind that I would ever be in a similar situation. By that night's gala, Target House 2's construction was already underway, which Michael was involved with. Michael also played a key role in the development and execution of the annual St. Jude Thanks and Giving campaign, which was launched in 2003. Shortly after that gala I attended on the night of my 40th birthday, I became pregnant. Marit was in utero when I made my first visit to St. Jude. It was a moving and meaningful experience for me. I believe it's one of those places you have to see to fully appreciate. 6 months or so later, Marit was born a very healthy little girl. Shortly before her kindergarten years, she began exhibiting some minor nausea and occasional vomiting. I took her to the doctor in August of 2007 and asked the doctor if Marit could have a brain tumor. It was the summer before her kindergarten year, and the doctors attributed her symptoms to anxiety. As the school year progressed, these intermittent vomiting periods continued. Despite numerous trips to the doctor throughout the school year, the doctors continued to tell me that they believed her symptoms were related to separation anxiety. By May of 2008, Marit's symptoms had become worse and more frequent. In addition to the vomiting, she complained of headaches, being tired frequently, eye and leg pain. We also noticed her balance was very poor. Ultimately, it was a nurse practitioner who finally ordered an MRI. Though I was not exactly a novice in experience with adversity and tragedy, nothing prepared me for these words. There's no easy way to say it. Your child has a brain tumor. Later that day, we learned that not only was it malignant, it was metastatic as well. Once the devastating words, "you have cancer," are uttered, life is never the same. Shortly after hearing Marit's diagnosis, I remember someone saying to me that cancer does not just affect the individual who has the disease. Rather, cancer affects everyone in the family. Believing that statement, we decided to battle cancer together as a family, ultimately directing us to St. Jude. Thanks to our gifted and wonderful surgeon, Dr. Naguib, who's with us tonight, Marit came through surgery beautifully at Minneapolis Children's Hospital. When Michael and I got the pathology results, we both fell to our knees and thanked God the results revealed the tumor to be a medulloblastoma. We had already done enough research to know about other possible tumor types, their prognoses, and even some of the associated treatments. Despite our long history with St. Jude, we didn't immediately make the decision to go there. However, as we did our research, all roads continued to lead to the research of Dr. Gajar and his work at St. Jude. It took all of one phone conversation with Dr. Gajar to decide that St. Jude was the right place to go for Marit's treatment. This world-renowned physician communicated both hope and confidence. Within a few weeks of Marit's surgery, we were packed and en route to Memphis to begin treatment at St. Jude. I could honestly stand here for hours and talk about the merits of St. Jude Children's Research Hospital, but I only have a limited amount of time, so we'll simply try to appropriately summarize some of what we love about St. Jude. But first, Mara would like to tell you the things she loves about St. Jude.
Hi. Hi, my name is Mara. And I'm a cancer survivor and a St. Jude kid. I loved it there. There were great doctors and nurses who were very caring and kind to me. I lived at the Target House with my family while I was a patient at St. Jude. It was nice having them there to cheer me up. My treatment included 6 weeks of radiation and 4 rounds of high-dose chemotherapy with stem cell rescue. I don't like cancer. You would never want to do what I did. I threw up a lot. I didn't feel good. Still, I felt very comfortable there. All the people at the hospital were very respectful and made me feel special. I feel so much better. I am really happy that I didn't die. It took me a long time to fully recover. Although, as a result of treatment, I lost my hair and may never get it back. I also have hearing loss and have to get a shot every night to help me grow. And those are just some of the side effects I live with. I still go back to St. Jude every 6 months for follow-ups appointments. I look forward to my visits there. I even like the food now that my treatment's over. Thank you. I thank St. Jude Children's Research Hospital for the gift of my life. I hope that a cure for cancer is found someday so that no child will ever have to die from this disease. Please continue to support St. Jude Children's Research Hospital so that a cure will be found. Thank you.
As patients or parents of a patient, we believe St. Jude Children's Research Hospital is indeed the world's finest hospital for children with cancer. Here are just a few of the most important things we love about St. Jude. First and foremost, immediately upon arrival, we felt a genuine sense of hope. Though I may have had personal moments of doubt, there was a consistent sense of hope that permeates throughout the hospital. Secondly, the compassion I felt from all the staff we encountered, including care providers to cafeteria staff and housekeepers and anyone in between, was positively heartwarming. I truly believe the St. Jude employees are servants of God, and the hospital is a sacred place. The personal care Mara received was nothing short of superior. In addition, the staff considered, respected, and included the entire family along the treatment journey. Thirdly, there is an overall physician philosophy of Pediatrics 101, listen to the mother. You cannot imagine what that overarching message meant to me after months of contending with the opposite mentality. Finally, the excellent outcomes via St. Jude's continued research and experience are the best in the world. St. Jude has helped push overall cancer survival rates from 20% in 1962 to over 80% today. St. Jude has helped push the medulloblastoma survival rate from just 10% in 1962 to over 85% today. My personal journey at St. Jude was undeniably a life-altering one. The experience has left an indelible mark in my heart and in my soul. During treatment, I became connected to so many other people who were on similar journeys. Many of these children whom we met have passed on to eternal life. It is in their memory, along with our collective experiences, that I am inspired to embark on this endeavor to help St. Jude Children's Research Hospital for the remaining days I spend on this planet. I ask myself frequently, how can I adequately thank a place like St. Jude and the people who work there for saving our own child's life and for tirelessly trying to save other children's lives? And how can I adequately thank all of you who have supported St. Jude? One way is by telling our story, by thanking each and every one of you in this room for listening, and by asking you to continue to give from your heart to this magnificent hospital. Mara and I and the entire Francis family thank you for being here tonight to listen to our story and for supporting St. Jude. I humbly thank you from the bottom of my heart.